Hi, we're going to do skeletal system today. So we always look at the structure and the function. Today I'm going to look at the function first of all and get that covered and out the way. I know my microphones are very sensitive and I've just put a fire on, and so you might hear a lot of background crackling. I do apologise for that. And also because we're homeschooling, my kids are upstairs and they are chatting away to certain friends, so hopefully there's not too much background noise. So let's have a look. So first of all, the skeletal system forms our structure. It forms the structure of the body as the skeleton itself, and it provides movement. So it forms movement. It forms joints. So it has joints, and it provides the attachments for the muscles and tendons to attach to the bone. It's protective. It protects all the organs, and it also stores minerals. So it stores calcium. And another function in the cancellous bone marrow, the spongy bone, has bone marrow, and it produces red blood cells and some white blood cells as well. A bit wobbly, my old skeleton. Okay, and yeah, as well as calcium, it also stores phosphorus. Okay, so let's have a look. I'm going to keep it quite simple so that it's not such an in-depth study here, and I can leave it to you to go ahead and review yourself. But when we look at a section of a bone, or the length of a bone, excuse my crude drawing here of a bone, don't let the woofers see. Anyway, this is a sort of bone. This looks more like a long bone, and we'll talk about the classification of bones in a minute. But this is a long bone, and this dense, there's two sections. This is sort of like a dense, compact bone. So we've got compact. I don't need to shout. I've got my microphones on. I've got compact bone, and the compact bone is the dense, hard, solid part of bone. And then we've also got this cancellous, and this is cancellous, and this is spongy, and this is where we have bone marrow. Some bones have it sort of within the bone as well. Largely found at the ends of bones, but some of the shorter bones, it has it sort of within the bone itself. Bone marrow that produces red blood cells and white blood cells. So if you were to look at a cross section as well of the bone, we've got a blood supply. We have blood, and so we've got arteries and veins within there. And there's nerves as well. We've got nerves in there. So you can have a look in all your manuals and all your books of a cross section of inside the bone. We've also got the outer coating of the bone, this outer skin of the bone, called the periosteum. Is it like that? Or IUM? The periosteum. Periosteum, that's the outer skin. That's the outer skin of the bone. And as we've said, you get the muscle attachments. So you would have the belly of a mussel, and then the tendon attachments that form onto the bone, like that. Take that bit away. So from the muscle onto the bone that forms this attachment. And then of course we have the fascia that surrounds the muscle and attaches to the bone as well. So yeah, I'd say compact cancellous, the spongy, the periosteum, blood, nerves travelling through. And then let's move on to the classification of bones. And in your books and manuals, you'll find the classification of bones. And they are long bones, short bones, flat bones, irregular, sesamoid. That's all of them. So the long bones, the classification of a long bone would be that it has a length like a shaft of the longer bone here. These are long bones. And the femur is a long bone, and the tibia and fibula, these are all long bones here as well. We also find the metacarpals and phalanges are also classified as long bones. Even though they're tiny, they are classified as long bones. Clavicle, I always get confused whether the clavicle is a long bone or a flat bone. Yeah, the clavicle in this manual, sometimes you see it as a flat bone, but it's a long bone. So long bones, long bones, long bones, long bones, and then short bones, and the long bones create the ability for lever and movement and the length, and usually the appendages forming these levers and the ability to create that motion and movement. The short bones are more like a cubed shaped bone, and they are found in the carpals, which are the wrists, and the tarsals, which are the ankles, and they're more cubed shaped. They allow a bit more impact and a bit more density and compact sort of weight bearing joints. And so those bones can take quite a lot of pressure. And then we're going to have flat bones, and the flat bones you'll see. So the flat bones are the sternum and the clavicle, the scapula. Yeah. And the hip bones, the ilium, the flat bone. Yeah. And I think sometimes, again, the skull is, these sections of the skull at the top are considered, even though they're rounded, they're considered flat. And then we have the irregular bones. And the irregular bones, a lot of the facial bones are considered irregular bones, a lot of these shapes, because they are unique shape to the face. And then of course the vertebrae, the spinal vertebrae, the spinous vertebrae, spinous processes, the vertebral column, these are irregular bones. And then we have the sesamoid bone. The sesamoid bone is the patella at the kneecap, and also the hyoid bone within the throat. So let's go ahead and just name some of these, and you can go through and repeat these many times, but let me just go through some of them for you. So we've got the frontal, occipital, parietal, temporal, nasal, zygomatic, cheekbone, maxilla on top of the jaw, and mandible, the lower jaw. We've got the clavicle, the collarbone, and the sternum with the manubrium and the xiphoid process. We've got the scapulas, and we've got the spine of scapula. We've got humerus, radius on the thumb side, and ulna is under. We've got the carpals and metacarpals and the phalanges, both sides. Humerus, radius, ulna. And in the anatomical position, the radius is the thumb side and the ulna is under. Let's move to the ilium. Ilium, the hip bone with the iliac crest at the top. Ilium, ischium. Oopsie. Ilium, maybe if I just take him off actually. Her. It's a her actually. It's a lady. ilium, and the hip bone here. This is all often called the innominate bone as well. Ilium, ischium, and then at the front, oopsie, we have pubis, and pubis is separated in the middle with a little bit of cartilage. We've got femur, patella, tibia is the big shin bone, and fibula is lateral, this stick bone at the side. So femur, tibia, fibula, tarsals, the ankles, metatarsals, and phalanges. This heel bone in particular here is called the calcaneus. Okay, I'm going to go on to the rib cage. We've got 12 pairs of ribs bilaterally. Rib 1 starts right up here under the clavicle. We've got 7 true ribs. So 1, 2, 3, 4, 5, 6, 7. These all attached to the sternum. 8, 9, and 10 attach to the sternum, but they also attach with this costal cartilage. They have cartilage that attaches. And then 11 and 12 are floating. All 12 pairs of ribs attach to the vertebrae at the back. All the thoracic vertebrae. So 7 true, 3 false, and 2 floating, all attached to the thoracic vertebrae, and the first 7 attached directly to the sternum, and the 3 false attached to the sternum, but they have this cartilage. You can't really see it too well here, but this is represented as cartilage. And then we'll talk about the spine. The spine has a beautiful natural curve to it. It starts right at the top with the cervical or cervical vertebrae, of which there are 7. The top is the atlas and the axis. The first 2 cervical vertebrae is atlas and axis, C1 and C2, and then to C7. And then we move into the 12 thoracic vertebrae. So 1, 2, 3, 4, 5, 6, 7. C7 is in line with the inferior border of scapula. 8, 9, 10, 11, and 12. T12, thoracic 12, is in line with this lower floating rib. And then we move into the 5 lumbar vertebrae. 1, 2, 3, 4, 5. These are really nice and solid, big chunky lumbar vertebrae. And then we move into the 5 sacral vertebrae, and the 5 sacral vertebrae are fused as one bone called sacrum. And then we have 4 little vertebrae also fused that makes up the coccyx. So 7, 12, 5, 5, 4. 7, 12, 5, 5, 4. 7, 12, 5, 5, 4. Cervical, thoracic, lumbar, sacrum, sacral, sacrum, and coccyx or coccygeal. So they are, and then, yeah, I mean, there's lots more in the face as well. There's lots in the bones in the eyes and the sphenoid bone behind the face. Okay. I think other than that, let's go, I think that's okay, right? I think, if you've got any questions or anything else, please do post below or email me. I'm just going to go on to talk about the joints. The joints, there's different classifications. There's freely movable or synovial joints. They're the most commonly found joints. There are a few classifications that we can learn. First of all is the ball socket, and the ball socket has just that ball and socket here at the is it called the glenohumeral joint here, and the acetabulum at the hip creates that socket, and the ball socket joint creates full range of motion of circumduction. Then we've got the hinge joint found at the elbow and at the, I mean, some of them, it's interesting because you think like that the hip also like hinges, but it also does this medial and lateral rotation. I'm just going to move this out so you can see me just do a little bit of movement. Oops, sorry, we've got Sully in the way. Yeah, it sort of appears sometimes that the hip does this hinging when it does when we do a flexion. It looks like a hip, but the hip actually, as a ball socket joint, does a full circumlateral medial lateral rotation. So the hinges are of the elbow joint and the knee joint. The patella, femur, tibia, fibula do this lovely hinge joint. Then we have gliding, like a gliding joint that allows the carpals to glide over each other. And then we have a saddle joint that allows this motion. And then we have a pivot, this pivot movement here. This is a freely moving joint as the head and the skull pivots over the atlas and axis. And then we've got the slightly movable joints. And so the slightly movable joints are found in between the vertebrae, in between the processes of the spine. So you have all the vertebrae, and in between there's white fibrocartilage, which creates that bend and that lovely flexibility, but also keeps a rigidity in the spine so that we're not over flexing and extending. So we have this white fibrocartilage that's a slightly movable joint in between the vertebrae. And then we've got fixed joints, and fixed joints are found in the skull, where there's what's called sutras. And the sutras are these tiny, can you see them? Yeah, these little sutras. And this is a little bit like what we were saying on training last week, is that how they make earthquake proof buildings is that they have the capacity to have some movement if there's a shock. So just one other thing, I'm going to bring you back to the board just to sort of talk to you about the vertebra. Vertebra. Okay. So you can find a picture of a vertebra with. So this is a posterior. This is the posterior. This is the process, the posterior spinous process that you feel at the back of the body. And this is anterior, which is inside. It's the anterior vertebra, which is inside here. And then you have these transverse processes at the side, which are these. So this is anterior. These are the transverse processes. This is where you have the facet joints that attach. This is where the rib cage attaches, and then right through the center is where the spinal cord passes. So you have the spinal cord that passes right through the center of the vertebral column. And then on from there, we have the nerve branches as well that branch out. These nerve branches of the peripheral nervous system. So the vertebrae is hugely important and a very uh, it's the central column, it's the central nervous system. It also has an energetic presence with the governing vessel and the conception vessel and the chakra system and the Sushumna and the Ida and Pingala. And this central column, this central nervous system, the central spine carries so much weight and importance in our existence. And so to really look after our spines is super important. We did discuss in class the conditions of the spine, whether you might find a scoliosis, a kyphosis, or a lordosis. So there are some sort of curvatures that create differences in the body. For now, I think, let me just have a look. Yeah, we've discussed the conditions. I think that's a good review for you. So I will leave it there. And if you have any questions, any further questions, please do get in touch. And sorry, somebody's sending me lots of messages and they're coming up. Yeah, just please do get in touch if you've got any questions. Let me know if these are helpful, and I'll see you next time. Thank you so much.